My name is Ryan Hansen. I'm the founder of the Tara Hansen Foundation. We started in 2012 and we are working to improve maternal health standards.
Hi, I'm Gloria Bachman. I'm a physician at Rutgers Robert Wood Johnson Medical School, a professor in the Department of Obstetrics and Gynecology.
My name is Robin Dioria and I'm the CEO of Central Jersey Family Health Consortium.
I am Joe Apuzio, past chair of ACOG District 3. And I would like to introduce you to an exciting opportunity to assist in decreasing maternal morbidity and mortality through establishing an annual Maternal Health Awareness Day in your ACOG section or state.
I met Tara when we were in high school. She was 16, I was 17. She was this warm personality that you wanted to be with, you wanted to talk to do things with, explore with. We dated for 8 years and we got engaged, and by the time we were both 26, 27 years old, we got married.
I now pronounce you husband and wife. Ryan, you may now kiss the bride.
It was the quintessential American dream. She surprised me big time. I came home from work and before I could really even say hello, she's like, Ron, I'm pregnant. We were both shocked, but happy. We began getting the house ready and just kind of getting a plan on the type of parents we wanted to be. Labor and delivery all happened pretty quickly, and the next thing I know, I'm holding my baby boy for the first time. I look down at Tara, she's holding him for the first time, and I remember saying, what do you think he is? And she goes, I think he's a Brandon. I'll never forget that moment, looking in her eyes, the emotion and how proud she was. About a few hours after Brandon was born, Tara began to not feel well. She had some fainting issues that we were concerned with. We began telling our healthcare providers, our team. Before we left the hospital, we had asked the doctor, one last time, would you please check, make sure Tara's okay. She truly felt something was wrong. We went home, started to get settled in.
Hi, Brandy Bear. Say hello, everybody. Say I'm here.
We'd been home now for about 36 hours total. We're family, we're finally here. And she says, I have to call the doctor, I have to go in. Something's wrong. We ended up back in the hospital, and over the period of the next 2 days, her condition just kind of began to get worse and worse. She had an infection, and she had gotten to the point where it had spread throughout her entire body. And to watch the person that you love so much have to go through that and watch her just slowly become, almost incapacitated it's devastating.
Maternal Health Awareness Day really was prompted by an overwhelming feeling within not only the healthcare community, but in the general population, that obstetrics is a happy event and that moms and babies go home and do not have any problems or do not have any complications. Maternal Health Awareness is a reality check.
Maternal Health Awareness Day is important to me after losing my wife, Tara, in 2011 due to complications associated with childbirth. I believe it's a really important way for us to spread awareness and let people know that there are things and actions they can take to, one, improve awareness, and two, educate themselves to ensure that we have safer and more successful birth outcomes.
Maternal Health Awareness Day is really to educate two populations, our healthcare providers and the community at large, specifically women of childbearing age, women who are pregnant, and their families.
Stakeholders include not just obstetrical service providers and hospitals, but also others. Our legislators who promulgate regulations and laws concerning the health care of our patients, and insurance payers who determine reimbursement for obstetrical and postpartum services.
The most important point about education is that it can't be contained to one hospital or one medical center or one state, that it really has to be widespread.
Recognizing signs and symptoms of complications of pregnancy during the postpartum period is incredibly important.
We would like to see Maternal Health Awareness Day incorporated into the legislative efforts of every state, so that every year, everyone who touches a mom will be educated on what are the latest issues, what should we be doing to make sure that we continue to be optimally taking care of all pregnant women.
In our experience, Tara was the only one who knew something was wrong, and she was right. I believe this may have ultimately cost her her life. I do believe that empowering women's voices throughout the birth process is one way that we can combat that.
I'm very happy to say that maternal health awareness is now part of the formal curriculum at Rutgers Robert Wood Johnson Medical School, and it really is a very much needed part of the education of all medical students, regardless of what specialty they go into.
We are incredibly excited about our program and have had the opportunity to develop a complete suite of materials available to you, including educational as well as promotional.
So we have a way to go to decrease maternal morbidity and mortality, and everyone gets on board once they understand what it is and what we did and how to do it.